Hello, and welcome to SIU Medicine's Introduction to Scribe Education of the Touchworks EHR. Your education today will cover how to access Touchworks via Citrix, chart navigation through the toolbars, the provider daily schedule, note completion, and how to enter an order. Please begin by opening Internet Explorer in the browser bar and go to apps.siumed.edu. That is apps.siumed.edu. This will take you to the SIU Citrix Gateway. Within the gateway, click on the Touchworks 19-4 icon to open the application. The Touchworks login screen will load, and you will enter your username and password provided. The Touchworks username is in all capital letters, and you will be prompted to change the Touchworks password. This new password must be at least 8 characters in length and include a capital letter, a lower letter, a number, and a special character. After login, the Touchworks daily schedule will come into context. On the left-hand side of the screen, you can see the vertical toolbar. We have opened on the Chart tab. Along the horizontal toolbar, you will see we opened on the Daily tab. The Daily tab is where you will begin each day to see your provider's patient list. As you can see, the Daily tab is viewed by provider, and you are able to search for your provider name underneath the magnifying glass. After you have searched for a provider, it will now be added to the provider dropdown. I will now show you how to default to your provider each time you open up the daily schedule. Please move over to the right-hand side of the screen and click on Personalize. Here you are able to set a default provider. You can again look up your provider underneath the magnifying glass or the provider dropdown, and you are able to do this for up to 4 additional providers if you need to see more than one schedule at a time. If you would like to see more than one schedule, please go to the horizontal toolbar and click on the Schedules tab. Let's return to the Daily tab to review its content. You can view the daily schedule by AM, PM, or all appointment times. You can choose an appointment by the calendar date. You can move through to see appointments by the day of the week, return to today, or advance by week. The content of the daily schedule shows you billing information under the $sign, the note that has been started under the N. TC and SOC are worked centrally and may have a check mark. If it has a check mark, please do not remove, and if it does not, please do not add. You can see the patient's name and the time of their appointment, and then you'll want to pay attention to any comments that are here on the chart for the day. Typical workflow starts when a nurse opens a visit note and completes the nursing documentation. You will access this open note right from the daily schedule by clicking on the piece of paper. This action will bring you to the note authoring window. You can see that your screen is now divided up into sections. Along the left-hand side, you have the bone structure of the note or the content. In the center, you have your notepad where you can begin pointing and clicking and typing in the free text areas. On the right-hand side of the screen, you have access to the patient's chart, problem list, med list, allergies, and all documentation. And in the bottom, you will notice that this window starts populating with the information as you are clicking through the note and typing your document. Returning to the left-hand side of the screen, we'll review some common areas that you will be asked to document within. The chief complaint is a text box. The history of present illness is also a checkbox, or there are areas where you can point and click through depending on what your provider's preference is. The review of systems will load for male or female depending on your patient's sex, as will the physical exam. I'll call attention now to the little bubbles next to words. If you click on these bubbles, they will open up a greater detail window for you to document. If you have any procedures that are completed during the exam, you can document them here. Again, these are the little drill down bubbles where you can document extended details. And then the plan. The plan has a free text, but I'd like to call attention to the chronic care plan for SIU. This area is quality control documentation that the provider will have you use. The final item is the attestation. Click on SIU Provider Attestation and choose the Scribe statement. If there are any orders the provider has asked you to enter, you may do that from right within the note. Along the top of the screen, you have additional tabs. I'll call attention to the quick appointments in case the provider wants to reference the follow-up appointment or any other appointments the patient may have. For orders, you can jump in adding a new problem, adding a new prescription, adding a new lab, or the white arrow will jump you into clinician's choice. Please click that. This will bring you to the Add Clinical Item window or your order entry pathway. To begin an order, you will always need a problem or diagnosis to associate with the order. Along the left-hand side, you have your problem list for the patient, and by clicking on the piece of paper, turning the problem magenta, you have chosen the problem to associate all of your orders with. At the top of the ACI window, you have your history orders or orders that need to be completed. Let's enter a follow-up and referral order. I'm going to click on the Orders tab, the Follow-up and Referral tab. SIU only consult and treat orders are listed here. You will want to make these favorites. To make a favorite in your Add Clinical Item windows, simply right-click and Add Favorite. Go ahead and put a check mark next to the order in which you choose. You will see that there are yellow areas